Okay, for my NG video, I'm gonna practice on myself. I don't have a stuffed animal or a human to do it on right now. So before I walk into the room, I would knock on the door just to make my presence known. As I enter the room, I would wash my hands and introduce myself to the patient. Hi, my name is Abby. I'm going to be your student nurse today, taking care of you. As doctor's orders, I am to place your NG tube today. Can you confirm your name and date of birth? And then they would tell me their name and date of birth. I would check it against their wristband. For their allergies, I would ask them if they're having any allergies, just explain the procedure to them. Heard you have a bowel obstruction and we're just going to decompress your stomach. There might be a little bit of discomfort, but you just let me know if you're having any extreme discomfort whenever I'm placing it. I ask them if they have any recent nosebleeds, any nasal trauma, surgery, anything like that. They will tell me no. I go ahead and have my equipment set up. So I have my drape to go over the patient's chest. I have my tape. I have my little medicine cup with my pH paper, Kleenexes for the patients to wipe their eyes or nose, emesis basin, and then my cup full of water for the patient to drink while the tube is being inserted. So before I start any of the procedure, I would check the patient's nose. So I would take my pen light and just look up both nostrils to see if there's any nosebleeds, any occlusions, lesions, anything like that. Their nose is clear, so I could use any nostril. I would have the patient up in a high Fowler's position, the patient sitting up. The bed would be at my waist level, so I have access to the patient without having to bend over. I would get my tape ready. So I'm going to have 3 pieces ready. And then the last piece I would do fancy pants. So split down the middle, halfway. Oop. And bend the edges. And have that ready. Before I even insert the tube, I would go ahead and check the patient's lung sounds. So check every position of the lung as they take a deep breath. And then I would also check bowel sounds. So I would also have their shirt up or their gown up so I can hear it on bare skin. So they have normal bowel sounds. So before I would wash my hands before I do anything with this. I would have just regular gloves on. Take this piece out and keep that. In my hands, I would go ahead and wrap it. Give it a little squeeze. So the tip is a little curved, like so. So I would go ahead and have this draped over my patient. I would go ahead and give them a Kleenex, have them hold a Kleenex, and then their other hand, their glass of water for them to swallow as this is going down their throat. So before I even insert, I want to measure from nose to the earlobe, and then from the earlobe down to the xiphoid process, which would be about right there. So it's about 55 centimeters. And with one piece of tape, I mark that like so. So I would have the tip of this lubricated. I would tell the patient to go ahead and lean their head back. I would tell them that there's going to be a little bit of discomfort. If they have any discomfort or any pain, just to kind of wiggle their finger or alert me, and then I could stop. So this lubricated. I would also have my syringe on the tip of this, because that's what's going to draw up the gastric secretions. So I would go ahead, have the head back. They're going to have their water in their hand. Before I even insert this, I would check their gag reflex. They have a normal gag reflex. So you go ahead and insert it with their head back. Once I hear them kind of gag, I tell them to go ahead and start drinking their water. I keep fishing this down. I would have them when they gag, I go ahead and have them have their chin to their chest and keep fishing this down and down as they're drinking water. With every drink of water, I push down until I get to the tape that I measured off. So I would go ahead, before even doing any secretions, I would tape this to the patient's cheek. And then I can go ahead and listen to lung sounds again. If I have normal lung sounds, I'll go ahead and draw up some of the secretions. Go ahead and put it, close that up. Put the secretions in my medicine cup and check the pH. It should be from 1 to 4, and that's normal. And then I asked the patient if they're having any discomfort and if they tolerated the procedure well. They said yes. So once before I leave the room, I inform the patient that X-ray is going to come down and get them so they can do a KUB on them, just to check the placement. And if they need to keep the secretions or put the secretions back in. For this, when it's in and I already checked the secretions, I checked the lung sounds, I would take another piece of tape and tape it down a little further whenever it's down, get a little length so whenever they can move, they don't pull it out. But tape this to the cord or the tube, and then you can do a safety pin and put it on here. And then that will be secure whenever they're getting transported to X-ray. Before they get transported to X-ray, I would keep them up in their high Fowler's position, just so the patient doesn't lean back in case it's not placed correctly. I would ask them if they're having any pain, if they have any questions. Before I leave, I would wash my hands and thank the patient for their time and inform them that X-ray should be coming up soon.